Traumatic brain injury recovery.
Larry, what advice do you have for brain injury survivors, for their families, and what advice do you have for healthcare treaters?
Well, for the families, I would just ask them to look for resources, talk to their doctors, to insurance, see what's out there in the community for brain injury, and do whatever they can to try to hook up with those services to educate themselves as to what's out there, what they can do. And for the providers, that's another story. I think they should not look at somebody who had a brain injury and not try to identify with the family what the issues are. So we'll go back to the collateral source. They should, not just what they see if they come into the office and they look very normal, they might look just perfectly fine and talk well and say that they're fine, because many people with brain injuries aren't aware of their deficits. And see what the family says, and then let the family know. Even though the provider may not know what resources are available, they can encourage the family to seek them out. And one other area there's just a problem are patients that, I best would say, kind of.
Please like, subscribe, and comment on this video.